and then just have kind of a list of questions.
Yep.
So just to start off, what capacity do you work with or know about international or intercultural students?
So I'm pretty limited to right here in this little building at the health center. So my interaction with international students is when they are coming through my doors for a visit. That being said, like I said, this was my first fall on campus because I started last February. And so we were invited as health services, I guess, to go to the international, I don't even know, I'm sorry, what the correct term for was at the beginning of the year. It was like orientation type of deal. But unfortunately, we weren't prepped very well before we went to that, though, and what they expected for us to do. And so I actually wasn't at it. My two nursing staff went, and I guess we were on the impression we were going to talk a little bit about what our services were down here, but it sounds like they basically just kind of took in health forms. So as far as interaction goes, it's really right here in the clinic, and then there was that one small like outreach thing to the international orientation day or whatever that was technically called. I don't know what the right term for it is. And otherwise we just see students, I guess, at the flu vaccine clinics that we do in the fall.
Yeah. Okay. Has there been another one of those, like at the second semester of international students?
No, there hasn't been.
Okay.
It was only that one. And Brandon Wardland, the director, he's the one who set that up. And so you have to apologize that I don't know everybody's names yet in every division yet. I just know him as Brandon.
We won't either, so.
All right, so he's the one who sets that up.
Okay. Interesting. Do you know, did they also have like an orientation like that for just all students at the non-international orientation? Did they provide for that?
I have no idea. This was something that was special for our international group of students. And so as far as something equivalent, I have no idea. Sorry, I don't have a better answer.
No, that's fine.
As far as did we go participate in anything, what we participate at the beginning of the year is the welcome kind of kickoff out on the mall for the first year students, and we talk about health services, and then our staff goes to, once we're like 2 or 3 weeks into classes, we go do a fall into futures. It's in the evening, and once again it's kind of the same thing where a whole bunch of booths are set up and students can come get information about what services we provide at health services.
Okay.
So those are just for, the first one is for our first year, and the second I think is for everybody.
Okay. And can you let us know kind of what the process is for assessing care at CSB?
Accessing care, it's pretty much open to anybody because it's part of your tuition, the health service fee. So anybody can walk in our door and ask for services. There's 2 ways to set up an appointment. You can either call and make an appointment, or you can schedule certain appointment types online. Not all appointment types are available online. That service went up at the end of April last year, just to trial it right at the end of the semester, and we've had a lot of students scheduling online. As far as, we tend to be pretty full down here, so I guess we don't go out and do a whole lot of marketing besides the few signs that are maybe in the bathrooms, kind of about some of the mental health stuff, and we're listed on there, and then those 2 things, again, like the first year fair, that fall into future fair. Those are probably the biggest 2 things we do.
Okay.
So you said that the online appointment setup is only available for certain kind of appointments. So could you elaborate a little bit on what kind of appointments that would be?
So there's certain type of appointment types I usually want my front desk talking to the students so I can assess like what's the urgency of that appointment. So for instance, I don't allow mental health schedule online because I always want to make sure there's nobody suicidal and they're trying to make an appointment online. Because we may be full, but if I hear something like that, we'll try to probably work that student in. Same would go for abdominal pain because there's some more acute things that may come with abdominal pain, like appendicitis or something like that. So those are the main 2 that we probably don't have online. I'm trying to think what else might not be online. That's more, I don't put headaches online. I usually want my front desk to ask a few questions about headaches. Head injuries are online because we want you to be calling in to schedule a head injury, not scheduling it online. So my fear with some of those is that it'll delay them getting into the clinic in the appropriate time frame, or they may be more urgent. And so that's why I keep some of those appointment types off of online. There's a big disclaimer that says, if what you're seeking care for isn't listed, please call. Because not all appointment types are listed. It says something like that. So I'm hoping students are doing that.
Yeah. Okay. So what barriers do you think exist for international or intercultural students at CSB when they're trying to access this biomedical?
Yeah. Well, there's a lot, probably.
Oh, no.
So start off, there's always the potential for a language barrier. So even though they're coming to school here and we think they should be, fluent in English, they may not be, in particular when it comes to our medical terms. So we do have a phone interpreter available. We bring the phone in with us. We put it on speakerphone. And we usually offer the interpreter to everyone. A lot of students decline it. That being said, I think Carol and I, the other MP, we get a fairly good sense within a few minutes of the appointment if we think we better get the interpreter online because they may be not understanding as much as we want them to. So I think language is a big one. You said what are barriers for access? Just I think understanding what our typical processes for appointments as well. I mean, think of a good example. Like they may come in for fatigue, let's say, and I might say, oh, well, we should do labs to make sure you're not anemic or your iron's not low. Where they might be like, whoa, labs, what does that mean? And now how do I have to pay for this? And what do you mean by what's this insurance stuff that you're talking about? So I think there's just the systems in place with like insurance is potentially confusing. And then I just think too, we're very, you're right, we're very like cause and effect, whereas I think some students are just coming in for reassurance. And maybe that's all they need to hear is that this is okay or this could be causing this. The other big thing is mental health, and I don't know if I'm jumping around here a little bit, but there's big varying cultural beliefs in mental health and care of mental health. So I would say that's one of the biggest things. Most of the time I would say when they come in, let's say for colds and things like that, it seems to be pretty straightforward, and most of them are most of my patients are usually pretty accepting of, they want maybe something to dry up their nasal secretions, and that's fine. When it comes to mental health, a lot of my students from, in particular, like the Bahamas or from China, want to come in because they're feeling depressed and anxious, but yet when we start to talk about the chemical makeup in the brain and the role of medicine, because that's my side of it, and counseling's over here, see a lot of resistance. And when I ask them about cultural beliefs on that, many of them will tell me that we don't talk about mental health at home. I've struggled with this since I've been in 7th grade, and I've never gotten help for this. And so mental health, I think, is a real big one, where there's a big range of cultural beliefs. Does that make sense?
That does make sense.
So as far as barrier, I think because of that, those varying cultural beliefs, I think that probably is somewhat of a barrier for some students to come in and ask for help for mental health.
Okay. And how do you kind of know that these barriers exist then?
I think just in talking with students, like I said, as far as the language goes, I think Carol and I can tell pretty quickly when they're not, student or patient isn't maybe quite understanding. I try to do a lot of repeat back with me anytime I think there's potentially a language barrier, just to say, repeat back to me, what my instructions were, and right there is pretty telling, I guess, if I can't get that repeat back what I was thinking my point was, but what they're reflecting back to me. You said, how do I see those cultures? So language, I guess that's an easy one. As far as more of like treatment type of stuff, I think there too, if I usually always seem to say, are you okay with this plan? And I think you can kind of tell right there if they are like, I don't want to take an antibiotic for this type of deal. And so I do typically try to ask them, what were you hoping to get when you came in today, that type of thing. So that can be kind of telling as far as, well, I was just hoping to get some ibuprofen. Okay, well, I can get you that, that type of thing. So I think it's a lot of reflecting questions back to assess understanding. Understanding. I even made up my own word.
I liked it.
To assess understanding and if they're agreeable with the plan, I guess, on board with the plan of care.
Okay, yeah, and that makes a lot of sense for students that do come in. But like, what do you think about those students
that
who don't come in? Yeah, why would they not be coming?
It's a great question. So we've talked about this just briefly with Lori Klapperick, who's our health promotion director over there, just about the students who aren't coming in and why they aren't coming in. And we haven't changed it yet because they just did that general health survey last year, and that's an every 3-year survey. And so we have discussed that with the next general health survey, we'd like to ask more specific questions about if you have accessed the clinic on campus, but more importantly, if you haven't, and why haven't you accessed the clinic on campus. And then we said they already break down various ethnicity groups on that, so then we can certainly pull out the data for that was kind of our plan. So that's going to be a few years in the coming, though, because, like I said, we just missed that general health survey. It just went out last year, so it won't go out again until 2018. But we're going to make those changes on that 2018 survey, hopefully. That's something we've talked about.
Okay. And, like, until then, do you kind of have any just general impressions of why students aren't coming?
Some of it, I just wonder if students realize we're down here. Sometimes I'm surprised by the number of students that it's the first time down here, and they're like, oh, I didn't even really realize you were down here. So that's always shocking to me when I hear that. And like I said, we've always kicked around the idea of do we promote more? But I think there's this fine line there. If you promote a lot more, then all of a sudden, so we're ready. So we talk about something in the clinical world about like fill rate. So what's the percentage of appointments you fill every day? And we are typically filling at about a 80% fill rate, which is kind of the quote unquote sweet spot, because if you fill over that, then patients that call in for acute sore throat can't get in that day. So you lose that acute care access. So you need to have some. It can't be at 100% every day, otherwise you'll never have acute care access. So anyways, back to, I've always talked about, in this 1 year that I've been here, should we advertise more? Because coming on new, it doesn't sound like we advertise a ton. But yet, I think if we did, we would have to be looking at potentially expanding our size. Now, back to that international fair last fall. So we've talked about that a little bit more after the fact, and I would like to potentially do a little bit better of a presentation about what's available to health services, because if we have that audience right there in front of us, in particular international students that maybe don't understand this whole U.S. healthcare system, I think that would be a valuable presentation for the students at that point. Another big thing is our students from China, they can't access the HPV vaccine in China, and so all of them want it when they come here.
Oh, interesting.
And a lot of them don't, until they start hearing from friends, they don't seem to realize that we give it out down here. And once they find out, then they usually are coming for that full 3 series. And it's because they can't access it in China. So a lot of them want to get it while they're here. And so that was another thing we had talked about potentially presenting a little bit more at that international student orientation day. Sorry about that.
Oh, no problem. Okay. So what strategies have been implemented to improve the access for these students? You talked about kind of presenting at orientation, but anything else?
To specifically our international students, I would say no. I guess we haven't done a lot to say, here we are, and help them, get in for appointments. I would say no, we haven't done any specific targeted marketing towards the international group.
Okay. Do you know for like intercultural students that kind of just exist on campus?
Yeah, that are not international but intercultural. But no, as I said, I don't think we've really done a lot of marketing about health services down here. I mean, we give out all the stuff, like I said, at the first year resource fair and at the Fall into Futures, but beyond that, the only other real advertising we do is the flu vaccines, and that is just generalized to all students. We don't do any kind of specific targeting towards different cultures.
Okay. And like beyond marketing, like changing hours maybe, or like assistance like within the appointments, kind of the online material you talked about, but any of the other kind of like structural, logistical sides of the clinic, have those been adjusted?
As far, like my front desk, they do a fairly good job, I feel like, of helping students navigate as far as appointments go and what we all see. Hours is a topic that has come up a lot, and we've done a lot of different research on it. And I would say every few years we talk a little bit more about, can we extend hours or not? The problem is there's such a small staff down here, and until we get support from the college to do, and I shouldn't say it like that, so scratch that.
Okay.
But it's obviously it's going to take more funding for us to do extended hours. That means either bringing on more providers, which is going to cost money to do that, to extend out hours into the evening or the weekend. So it's something that I feel like we talk about. Or I shouldn't say we, as I've only been here a year, but I've been told that they talk about it periodically. And we even had a little bit of a discussion about it this year. But I do a student survey as well, and so far I haven't seen much as far as complaints about the hours that we run.
Okay.
What were some other things you asked me about?
Like assistant with specialty care appointments.
Yeah, we help all the referrals out. So if we think somebody needs to be referred for specialty care, we help the student coordinate that. We have an algorithm in place to help with transportation if needed. Because a lot of students don't have cars. And so we will try to help them to some degree with that, but yet, our students are also adults, and so they need to take some of that responsibility for that. But certainly we help with some of that as far as directing them in the right places to go to find resources for transportation.
Okay. Great. What barriers would you say exist for healthcare providers here in treating these international or intercultural students?
So last summer I did some work on kind of the top ethnicity groups kind of / cultures that we see, and we did put together a resource, and all the staff obviously reviewed it, and then we keep it out in our clinic area. And this was, I think I have a copy here somewhere. So just kind of as a bunch of tidbits about, like, for instance, for our students from China, how they really respect authority, and so they might just kind of say yes, yes, yes to you, but yet maybe aren't understanding what you're saying or necessarily agree with your saying. So, like, for them, repeating back instructions, checking with plan of care. Another one with them is that maybe they don't like touching, and so avoid touching if not necessary. So this is that document. Oh. And then we actually stock quite a few of our immunization medication sheets in different languages, our most common languages down here. So we stock all, they're called VIN. We keep all those in various languages down here as well. And then this link is on saved to every computer as well that we use, because it prints off medical information. So, like, for sinusitis in whatever somebody's primary language may be, because in particular with Chinese, there's a couple different types of Chinese written language, and then in particular for them, it seems to be that the medical translation is a little bit more difficult. And so we like to give them their printed materials in their primary language as well. We usually give them both, but that way they have it in their own as well. So those are kind of a few things I worked on in the summer and that we implemented this fall. So I don't know if that answered that question.
Yeah,
for you.
that's interesting.
So you mentioned with the Chinese students and the focus on authority, and then you talked about before about like the repeating back type of thing. Do you ever feel like you have a hard time with them being honest because they tend to just respond in a like positive manner to like please people? Do you ever find it difficult to like get through to them?
Yes, I'm not going to lie that sometimes I worry that sometimes I'm just hearing back the answer that they think I want to hear. And so I try to reiterate to them the importance of making sure you let me know that if you're not understanding this. And there too, if I'm getting too much yes back, I always question if they're actually understanding me, and that may be sometimes where we pull in the phone interpreter to make sure that I know they're understanding what I'm saying.
Is that interpreter just used through like St. Cloud or?
Nope, it's a international language line.
Oh, okay.
And we have a cordless phone that we just put it on speaker. When we call up, we just identify what language we need.
Oh, okay.
And I kind of have a question about this pulling together of data. What kind of prompted that initiative?
As far as like this?
Yeah.
So I think what prompted that is just a new person coming in. I was down at Mayo for 14 years, and I practiced primary care at Mayo for 7 years. And certainly I saw a wide range of various cultures and ethnicity groups, and I had a vast amount of transcultural resources at my fingertips. And so I just felt like I didn't when I initially came here, and I just think that it's just because Mayo had this whole transcultural page, and so I could just go and say, okay, I have here's things that are available in Spanish, education links, and it was just all very accessible. And so I had to do a little bit more digging since I couldn't access that page anymore. I had it because that's a intra type of website. Then I just wanted to put together my own resources for here.
Okay.
So that's what prompted me to develop this, is just being new here. I just wanted something that I could easily access.
Oh, so this was just a self-initiative. Like, this wasn't something they told you to do?
No.
Okay.
Nuh-uh. And then when my staff came back in the fall, this is something I just went over with them.
Okay. So they then had they had kind of resources like this prior then? You said it wasn't really available.
Well, there's always resources. Even the resources that I have linked now on that we have saved. I mean, these are external sources. So I don't believe like the College of St. Benedict on our intro website, we don't have any like specific transcultural things that are health related that I can access. I shouldn't say that. I'm not 100% sure on that, but I wasn't told that there was anything available like that.
Okay. Is there any other, because like that knowledge barrier is kind of large, but other things like that you wish that you could do to kind of ease the transnational student health process?
One thing that we started to work on in the fall, and I'll admit that was kind of late fall, and we haven't continued to work on it because I just feel like we've been busy, but hopefully it'll be another summer project, is actually with counseling, just working on a document about like how to navigate through insurance, because I think that's a really hard thing, and we see it a lot, as well as the counseling staff as well. And they don't bill insurance and things like that, but there's all these lingos about. So on this, we were going to define, and I have a rough copy of it, but define terms like healthcare provider and insurance claim and deductible and like all these things, because most of our students, both here as well as international, doesn't matter, are new to some of this insurance stuff, and a lot of students certainly are still at parents' insurance, but when we start talking to them here, as far as we're going to submit that to your insurance for XYZ lab, blah, 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 it's like gloss over, I don't understand what you're talking about, and that's pretty much everybody. But particular too for some students that are maybe not from here, like the United States, then that gets even harder to understand. So we were working in joint with counseling on putting together an insurance kind of easy to read document that kind of goes over frequently asked questions, defines glossary terms, that kind of stuff.
Are there any other kind of those frontline staff care barriers that you see?
For example,
like that insurance, like people calling in, just like the kind of more of that health desk, like bigger problems that they face and being able to care for students.
I don't think so. You know, the problem that I sometimes have is, and I think what is important maybe for your focus groups is right. I don't know I only know what I'm seeing walking through my door, and so I don't know, like, with the students calling in, what might be the issue with making the appointment. Does that make sense? So all I can say is what I've seen on this side is we certainly see a lot of questions about labs and workups, and then that whole insurance submitting and how that whole claim process works.
Okay. Is any of that data in those general health surveys? Like, what do you typically
insurance stuff?
Yeah, just kind of those barrier, like, information.
So I don't manage the general health survey, so
Okay.
I'll be on. I don't know what's on it. It's got 100 and some questions, I believe, and so Lori's the one who manages that. All I know is when we started to talk about fill rates and how many students from St. Ben's were accessing our care, we started to talk about, well, we know who's coming in, but why is XYZ not coming in, and why is it? Is it because of our clinical hours? Is it because you don't understand our scheduling system? Because you don't know we're here? You know, that type of stuff. So that's where that kind of developed. As far as, is there anything about healthcare in general and the barriers? I have no idea.
Okay.
That general health survey, though, is online, and you can access it, so you should access it and maybe look at it for your class, because then you can see all the questions that are on there.
Yeah.
I'm sorry, I can't tell you specifically
Oh,
what's
no,
on there.
thank you for...
Because there's a lot of questions about, like, you know, sleep and nutrition and exercise and substance abuse and sexual activity and all that kind of stuff's all in there. I don't know if there's anything about coming in for health care. And I certainly don't think it specifies, though, here versus general health care.
Do you think there's any barriers for medical providers in understanding the health concerns? Like you kind of talked, you made this sheet to help you. Like, do any of the other providers say they kind of have issues with?
Absolutely. I think we're all learning all the time. And I may make a sheet like this and I'll pull it out and look at it, but that doesn't, by any means, I don't feel like I'm an expert in any cultural group that walks into my door that I'm going to see. All I can hopefully do is make sure I ask if there's any specific, you know, concerns and or beliefs that they may have that impacts their care or what impacts my treatment plan. But I definitely don't feel that I'm 100% confident and knowing everything about every cultural's medical beliefs.
Yeah, I mean, there's a lot to
know and learn. And
there's a lot. All the time it's changing. Is there any kind of like education services that the healthcare providers get on that? Like any continual trainings?
Well, we have we certainly always have the option to do our own continue ed, so whatever's what we're interested in. As far as have I done anything that's transculturally specific for the last few years, I don't think so. And I can't speak if Carol has or hasn't. Carol's done a lot of different travel medicine things, but not necessarily transcultural. But yes, we always have the opportunity to do what we call as continuing medical education credits.
Okay.
So there's always that option to do that. I have not did any CMEs, though, for transcultural in the last few years. We have transcultural types of education way back in my nursing background. I certainly did, and then in my master's as well. And I can't speak for Carol's education, but I would assume she got some too with her nursing degree.
But none specifically like through the school when you got here?
No.
Okay. Interesting. on kind of a different note, how do like medical providers accommodate to these different health beliefs, like when they do kind of come up and you're dealing with managing students' illnesses?
Oh, this is where I'm like, okay, Emily, think of some examples so you could say, okay, with this scenario, I did this. I guess the biggest thing is you have to ask, because if you don't ask, you don't know, and then you can't be respectful or try to accommodate whatever cultural beliefs they have. As far as I've had some students talk about acupuncture, and we have a referral book that we use, that we have a few acupuncture providers in there, but certainly it's probably not I'm sure we're not capturing everybody in the area that would be available. And, when it comes to certain, like, back pains and things like that, I'm just trying to think of specific examples. I'll certainly talk about what I may do for treatment, but then ask what other things they were thinking about. And I would say if that's where acupuncture's come up a few times, as well as headaches. And then sometimes chiropractic care will come up there. I haven't had any students ask about providers for, as far as, in the area for, the cupping or anything like that. I did down in Rochester when I worked there, but I haven't here. I think like I said, you have to ask, otherwise you don't know. And I think the hard thing there, too, is I keep saying international, but obviously it's not just international. We have a lot of different students that are from the St. Paul, that are Hmong, and from various areas that are Hispanic. And so you hear they're from Minnesota, and you have to remember that just because they're from Minnesota doesn't mean they 100% agree with, our traditional way of doing things. So I don't know how to say it, but sometimes you just start to get a sense that they maybe aren't quite on the same game plan as you, and that's where you have to step back and just reassess. Are you okay with the plan that I'm talking about, or is there something else you'd like to explore or do? And I think sometimes that's where it comes out, and it's like, oh, okay. Well, what do you do for that? And that's where sometimes they'll talk. I'm thinking in particular about some of my Hmong students. Well, they'll talk about some of the hot and cold they may use, for various illnesses. And so I think the number one thing is just to assess.
Okay.
It was a really long-winded answer.
No, it was a good answer. Then when they kind of come up with these side treatments, how able are you all to react to kind of this different style of treating illnesses?
I think it all depends on the what I would assess as the severity of something.
Okay.
So if I think it's like something that is more acute, like appendicitis, and I'm saying you need to go in to the urgent care, and I'm meeting resistance, I really need to spell it out that I understand that, but what I'm concerned about are these XYZ type of negative consequences. If it's a cold and they may not, or a positive strep throat, let's say, and they say, I don't want to do antibiotics, I don't agree with antibiotics, that type of thing, okay, I might be a little bit more likely to say okay to that, because you're right, your body probably will naturally clear strep, and the consequence of rheumatic fever is really this low down here, but I have to let you know about what are the consequences, what could happen if you don't treat. And that's where sometimes, I hope they're understanding, and that's where you have to do that reflecting back, meaning they're comprehending what I'm trying to tell them. And that's where you have to do that reflecting back as, if you don't do you understand what I'm saying? Can you repeat back to me what the consequences might be if you don't use this antibiotic? Does that make sense?
Yeah.
It's such a fine line. I really like to give the student a lot of times the choice. And some students like that. Some students are like deer in the headlight. Like, don't give me the option, because you just need to tell me what to do. And so sometimes when I get met with that deer in the headlight, then I'll say, okay, you look uncertain. If it's okay, then we'll just do this. What I recommend. So.
Okay. How common is that kind of resistance to?
I would say
biomedical?
it's probably not that common. I
Mhm.
don't know. I'm like thinking, do I give you some sort of stat? Because I don't really know. I would say it's the majority of the time, students will usually agree with plan of care or tend to, when I give them the options, they usually choose the one I want or what I'm thinking.
Mhm.
But there is certainly a handful of times where they are not wanting to do what I recommend,
Mhm.
and that's their choice.
Yeah.
Mm-hmm.
And then does that normally get resolved, like the health issue?
I hope so. I worry about them, and I tend to call them a lot, and the
Mhm.
majority of the time it does actually seem, I feel like, to get resolved. Yeah. Mm-hmm. But they make me lose sleep for a few nights. I'm a worrier about.
Mhm. And so we have, like, in an interview with you last year, you kind of indicated the health services would be contracting for interpreter services.
Yeah.
And so you said
Set
that
up. I said
phone
that.
thing.
That was a huge thing when I came from Mayo that I was very much shocked that we didn't have here,
Mhm.
and so that was something I got set up pretty quickly.
And that went pretty seamlessly?
Yeah. Mm-hmm.
Was there any other kind of, like having that newcomer insight on just like,
Mhm.
oh, this is what we've done at my hospital and this is what
Mhm.
happens here? Any other bigger transitions or things you wish could be more enacted?
The interpreter was a huge thing. Like,
Mhm.
I was pretty strong in saying that we absolutely had to have that service here. The only other thing, like I said, was just I didn't feel like I had very good transcultural resources initially.
Mhm.
In particular, what I think I used probably most off of that Mayo was this a link to translate health information. So it took me a little bit of time to find a site that I thought looked reliable and good to use, because Mayo had their own internal site. It wasn't an external. So that was probably the other thing that I missed that I used quite a bit, was that, because I want to give that patient ed handout in their primary language. Mm-hmm.
And so, like, it's only been about a year since that's been implemented. Have you kind of seen any changes in care because of it?
Well, I'm not sure. Once we send out that patient care survey, but I haven't seen anything specifically back about, like, I appreciated the use of the interpreter during my visit, or I appreciated the printed out material. I haven't seen anything specific like that.
Okay.
And to be honest, I haven't really followed up with my staff to say, has this been helpful or not? It's something we went over in the fall, and like I said, we have it out on the board back there.
Mhm.
But I haven't followed up with them to say, did you find this helpful? And maybe that'll be something we do in the spring as far as the wrapping up the year. Was that helpful at all? Did you use it? What changes could we make? And probably, what do we need to add to it, right? Because this is a pretty short list, and I know we see lots of other cultures coming through our door.
Yeah.
This is just a kind of short list I made over the summer.
Is there any other strategies that have been implemented since the health clinic opened?
Yeah, I can't really speak for what happened before I came here. I had a 1 day short, quick overlap with the previous director.
Okay.
And so I guess I'm not sure what things she specifically did. Maybe, I have no idea, to be honest with you, what was done before I came. I can only speak to the few things I've done since I've gotten here.
Okay. And do you know at all, like, any strategies that have been done at the SJU Health Partners Clinic?
No, I don't know.
Is there ever, like,
about
communication between...
that is Health Partners isn't part of the college at all. So whereas I am under student development, and we go to general student development meetings and things like that, Health Partners isn't a part of that because they're technically not really a part of SJU.
Okay.
You know what I mean? So they don't come to any of those joint meetings.
Yeah.
So, right, we don't really do any kind of joint meetings with them at all.
Is that ever a problem? Like, do you get students who have gone there and then come here and...
Oh, most certainly. That maybe went over there and then they came here, and right, we don't share the same medical records, so I can't necessarily see what's going on over there and when they come here. ideally, it would be fabulous if St. John's would someday get their own health center that was actually part of St. John's, and we could very freely share, and I think it would open access to all of our students if they could be seen on either campus, right?
Yeah.
Because then it would fit into your schedules better if you're over at St. John's all day or vice versa. That's a whole different probably topic and conversation, right? I think that would just certainly help everybody's access to getting care.
Because you only see bennies, right?
Only see bennies because
Okay.
it's part of your tuition, that health fee, which is why you can come on down here quote unquote free because it's part of your tuition. But St. John students can't come down here because they don't pay that health fee.
Okay. Interesting. So how well do you think international intercultural students understand biomedical care, like when they come in here?
I certainly think my students that are from the U.S. understand it because a lot of them are growing up around it. So even if they're using other forms of health care or their traditional medicine, that's the right word, right? I think they're still most of them seem to be pretty aware of Western medicine.
Okay.
Thinking about some of my international student groups, I too think they have a pretty good grasp of Western medicine and what to expect, and I may be wrong when I say that, but most of them do seem to typically understand, well, I shouldn't say that. My students from the Bahamas really do. There's been a handful of some of my students from China that really, we've had to walk them through and show them, this is our exam room, this is a stethoscope, the blood pressure cuff, and what that measures. And so there's been a lot of education on some of those initial visits about that, because it is very foreign to them. So, what was the original question?
No problem. Just how well do they understand biomedical care?
So I don't know what to give you again percentage-wise, but I feel like the majority really do seem to understand. Once again, I just think there's that handful that come through that we really have to walk through and show them what everything is and explain what it is. And how do you know that? You can tell, I feel like, pretty quickly when they're like, what's that, to the blood pressure. And when I say, I'm going to examine you now, they're, what's that mean? And, I want you to come up here. And then you explain the whole process to them. So I would say the majority seem to understand. But do I ask every student that walks through, do you understand? No, I think I just try to assess it.
Read it.
Right, reading their body language. And
Okay, that makes sense. How beneficial do you think they find biomedical care?
I don't know. I've never asked them. I would say the majority of them seem to take the treatments I give them and follow up by usually if they're not working, and don't if they do. And I would say hopefully I would know if it's not working, because hopefully I see them back and follow up. So I haven't right out asked them, do you think it's beneficial? All I can say is that whole reflecting back and do you agree with the plan of care? And I guess that's where I might assess what they think about what I'm prescribing, if they think it'll be beneficial or not.
Okay. What about like the American insurance? You already said there's kind of issues with that.
Yeah, so some students though will come from insurance from their home, and so we're kind of unique in that we don't, so when you come see us, it doesn't cost anything, like I said, because it's part of the health fee. So I'll give you an example. So if a student comes in for strep, the strep swab is $5, and if they're positive, the antibiotic might be $8. And so when they leave, they pay $13, but you just charge it to your student account. And they can get an insurance ticket, but and submit it to their insurance, and this is where some of the explaining comes in, and what does that all mean. Most insurances don't cover a $5 strep swab because that's way cheaper than what most clinics run. And a lot of them already don't cover an $8 antibiotic because most co-payments for drugs is $10. And so unless somebody has a house spending account, a house spending account will reimburse that $13, but it won't. So, okay, this is where things get like, oh, right? Where students start looking at me, and this can be across the field, and don't understand what I'm talking about, and that's where we talked about some of that insurance lingo sheet we'd like to give them. And we already have one for our lab that we give them. But some of our students do come from, or some of our students from Bahamas come with their own insurance from the Bahamas. And so I always have to have them, they can get all that care here. The bigger issue is when we start drawing labs for something. Most of the time we'll stop and say, we'll try to walk them through the process of get out your insurance card, look at the back of it, see that number there. You need to call them and see if we are in network. And so then I have a separate little half sheet lab paper that we give them that says that, like, call and see if MedTalks is in network. And then if so, then they can come back and get the labs with us. If not, then they need to ask, well, what would be covered? How much is that lab covered?
Okay.
That is very complicated for all my students. And I probably would have felt the same way when I was in college. And that's gets back to where me and one of the counselors have talked about, do we need to make a straightforward, try to be easy to read, frequently asked question type of sheet for insurances, because it's very confusing. So everybody has to have insurance when they come here. If you don't have insurance, then the college provides you student insurance. So everybody should have insurance when they walk in the door. Do they really need it? The only thing they really need it for is if we draw labs. But I tried to answer the basic insurance questions. But I think insurance, the knowledge barrier around, or the lack of knowledge, there we go, around insurance is a huge barrier. Huge barrier. And it's really hard to explain insurance to students.
I feel like we're in like healthcare classes and it's still like, wait, what? I gotta look it up again, call my mom.
Oh, it's super confusing. And even if I feel bad because even if you're that student that has, I think about, like, let's say a student that maybe already has even a language barrier, and then they now need to call the back of that insurance card and speak to Joe on the other end about, that's really hard to navigate.
Yeah.
But unfortunately, like, I don't have the resource for my desk staff to do it because they're already doing so much that they can't usually help that student with that call. So insurance is a big barrier, or the knowledge around insurance.
How motivated do you see students in like following these recommendations of like, or even the steps of doing insurance or the medications they're given after? Like,
I would say, and I don't know if it's just because of this age group and highly motivated, but most of our students are pretty good at following as far as treatment plans. More so than in my previous job. I would say most of our students, even I would feel like my students from other cultures are pretty good about following plan. As far as following up with their insurance, I have no idea if they do or don't. What happens if they don't follow up with their insurance is they get a big old, potentially, like for instance for labs, is they get a big old bill from our MedTalks lab. And then we sometimes will hear back, my desk will. And then explain to students how to resubmit that to hopefully get reimbursed. But in general, I feel that our patients and students really do follow recommendations.
Okay.
I don't have very many non-compliant patients here like I used to. So I don't know if that's because of this age group or the gender or what, that females are
women
are more compliant than men, or what?
What happens when you do have those non-compliant students?
Oh, and of course I still have some students that are maybe non-compliant with plans. I would just say the one particular example I can think of off the top of my head is just continuing education when they come in, appointment after appointment, and why I'm recommending what I recommend. And then it's, if they're not compliant, I can't speak for Carol, but I'm most certainly assessing for barriers. Is it the cost of the medication? Are we not understanding what it's used for? Is there a different reason why you don't want to use the medication, and so trying to tease out, well, why are we not being compliant?
What's the most common reasons you get?
Expense. So some of them examples off to my top of my head for non-compliant patients would have to be asthma, and coming back in for frequent asthma attack / cough / issues. And I would say the number one barrier is cost of that medication, and then just forgetting to do it because it's got to be daily.
Mm-hmm.
And then one more is that when they feel better, they stop, and then the asthma symptoms come back.
Mm-hmm.
And so it's hard to sometimes to educate that, yes, you're feeling better, but you have to stay on it because that's why you're feeling better.
That whole follow through.
Yeah.
Mm-hmm. So that was the whole continuing education is a perfect kind of transition into our next question, talking about health literacy.
Mm-hmm.
And so I'm sure you're aware, but we have it defined as it represents the cognitive and social skills which determine the motivation and ability of individuals to gain access to, understand, and use information in ways which promote and maintain good health. And that's from the WHO.
Mm-hmm.
So I'm going to kind of ask you for estimated stats for these.
I'm not figuring, you probably are figuring out. I don't know if I'm really good at estimating stats, but I'll try.
That's totally fine. So could you kind of estimate the level of health literacy for international student population at CSB?
As in estimate as like poor, fair, good type of deal?
Yeah.
I'll say fair.
Fair for international. What about like intercultural?
So that's tough. So what I'll say there is that I feel like it might be variable among some cultures. And so what I'll say there is like, I would say amongst my African American, I would say it's pretty fair to good.
Okay.
Whereas I'd say among Hmong, it would be more fair, it seems to be. And among like Hispanic, I would say more fair to good. Yeah.
What do you think the differences are kind of in that between
and why
different
like
cultures?
why is that?
Yeah.
I wonder if it's somewhat of, because even I said, what did I say for my Hispanic group? I said more fair. I guess I'd say more fair. And I wonder if it's somewhat to do with what's primary language spoken at home, if that affects that health literacy. Because even though I'm in this group of students I'm thinking about them, they all seem to be very fluent in English, but I just would hypothesize that, that would be the main reason is that maybe English isn't their primary language.
Okay. And what would you say for the health literacy for like the entire student population on average?
I'll say, I should have said like very good. I'll say good.
Okay.
I wouldn't say it's like really good.
Yeah.
I'll say good.
Okay. Great. What are kind of the biggest problems that you're aware of when it's not the very good? Like, what is kind of holding back?
Well, I think a lot of different health myths. I think that's probably why I won't say like the general is like very good. I'd say there's lots of different healthcare myths that circulate about various illnesses or home remedies or diseases, that type of thing. So I think it's just, and then that darn Google. Like so many students come in with a very concern that they may have, for instance, like cancer. And I have made it I almost always ask, well, what did you Google? What did you see on the internet? Because, and I learned this in my previous practice, if I didn't, you might miss what that student's worried about or what that patient's worried about. And I think it's important to address that patient's worried about. I would never it's not cancer to a patient in my room, ever. I would ask, what did you read about on the internet? What are you concerned about? So I can say, well, you're right. That could be a cause of your headache, but this is why I don't think it's a brain tumor. And give them why I don't think it's a brain tumor. So I do typically try to do that too. So the internet or Google, I think, leads into some of those myths or around different disease states and remedies and all that.
Okay. What do the healthcare providers here at St. Ben's do to aid the health literacy of their patients? And like, do those strategies differ when you're working with intercultural or international?
Yeah, I would say, the biggest thing is that I think Carol and I usually do try to give written out instructions or handouts. So, like, if somebody's newly diagnosed with, like, C. diff or something like that, which isn't very common, we're going to give you a handout about it. And I try to point out, like, what you can be doing at home, what if there's any kind of medical prescription, what that is. And then that's where, like I said, I was missing this. Says for my other, if English isn't the primary language, then I guess that's where I'll assess that sometimes, is I'll always print them out from that website in the other language.
Are there any other strategies that like some healthcare providers have found to be helpful in improving this literacy?
And then I guess the other big thing would be like just visual, visual teaching. So we have a good book with the different systems, and so we might pull that out to show them. Like for instance, like if somebody's got a area of numbness, I'll always pull out something called the dermatome map and show them where that corresponds to the area on their back, and so that helps with that visual aspect of trying to teach them. So we have various models, or like female anatomy is a big one that we'll pull out to show them the book, and this is what happens here when you have your that type of stuff. So I'd say images is the other big thing we probably pull out.
Okay.
And pictures of stuff.
And kind
Rashes
of like
is the other big thing we pull out our books for.
Oh, okay. Outside of the clinic, is there a lot of education you do? Like I was at that sex, milk, and cookies on Monday, which is awesome.
So that is really the kind of first like outreach thing that I've done since I've been here, and I know the previous director maybe had some various thoughts about that. And so once again, it's always this fine line if we start to say yes to too many things, and then there's then a lot of evening programming that can be going on. I wouldn't mind being involved in maybe one or two things per semester, but that's about, I have a family and stuff at home too, so that's probably about all I personally can do. The only other big outreach things we do in the fall at the flu clinics is try to get out on campus to do those.
Okay.
With students.
How do providers go about treating a patient who doesn't believe in the treatments that they're being prescribed to them, which we kind of touched on?
Yeah, all you can do is respect it. And like I said, assess the severity of if they don't follow treatment plans. So some things like a cold, or like I said, if it's a cold would just be basic symptomatic care anyways, and you can kind of treat that as you want to treat it. But if, let's say, it's a known infection like a strep, you go over the risks of not following the care, and that's all you can do. And like I said, if I really feel like there's language is the barrier, that might be where I pull in the phone interpreter if I haven't already before that. I would assume I probably would have before that already.
So, like, looking for just, like, the future of the clinic, what are, like, the biggest things that you wish would be done a little bit differently or that you're hoping to change?
Oh, that's a great question. If you want to talk, I don't know how much of that relates to your paper. Like, big picture, I'd love to get x-ray on site so I could not have to send students in the St. Cloud for x-ray. We have a pretty good turnaround on our labs, but some labs I wish I could go back in a day or the same day versus the next day. What else is my future for the clinic? I don't know.
Is there anything specifically culturally inclined?
Well, I would say this, like, the conversation that Lori and I had, I don't really know what the barriers are. I don't know why students maybe aren't coming in. And I would like to know, because I can't address it until I know the barriers. So I think that'll be important information for me to get like I said, the only unfortunate thing is we have to wait probably 3 years to do that. Because what they do this year is the alcohol survey, and then next year they do a more, I don't know. There's a specific survey on year 3, and then it goes back to the general health. So it's on a rotating basis. I don't know what happens on the 3rd year. Sorry.
It's okay. Would you suspect that is a big issue? The barriers of students coming in?
I don't know.
Mm-hmm.
Like I said, we have pretty good fill rates. We're busy. Our numbers are going up all the time. So students are coming in. But what I don't know about is the students that aren't coming in. And so, like, in that conversation, like, I don't know if it's, you know, we've gotten a few comments maybe from student teachers, well, I can't get in because of the hours of clinic. So how big of a barrier is that? Because I only hear about that from, you know, a few students, but how many more are out there that maybe are saying that?
Mm-hmm.
And if I don't know that, maybe changes can't happen, or I can't put the data behind some of those concerns to initiate the changes. Does that make sense?
Yeah.
So I don't know what the barriers are, but we need to know. We're being used, but the question is if there's still 3/4 of the students that aren't coming in, well, how do we get them in? And well, then if they're coming in, then we're going to probably need to get the support to get more staff down here.
Okay.
This is not bad things.
Mm-hmm.
It's all good things.
Growth is good.
Absolutely. And, you know, the clinic is still relatively new. It's only been, what is this, year 6? I mean,
oh, wow.
So, and it continues to grow every year. So, 2009 it opened. So, year 7? Year 7. This was the start of year 7.
So before that, did students just go to Health Partners then?
Yeah, so I graduated from here in 2002. And so when I was a student here, do you know where that Michael Coronado dentist is?
I don't think so.
It's like between here and the old El Paso. There's a brown building there. And so the St. Joe Clinic used to be there. And so you could walk there from campus. But then when the St. Joe Clinic moved out there really wasn't accessible care for St. Ben students unless they went over to St. John's. And I think that's part of what helped, or I think that's when some of the conversation about getting a health service on campus started.
Okay. Interesting.
Mm-hmm.
Is there any other questions you have?
I don't think so.
Okay. Is there anything else you want to say still more on this topic that you feel you didn't touch on?
I think it's a good topic. I enjoyed reading the paper last year. The only question from the paper last year, though, was out of the focus groups. I guess specifically for me, information back is, you know, what was related to here care versus related to their at-home care. Does that make sense? Because it wasn't very specified in the focus paper or the paper that you know, when certain things were coming out in the focus paper, well, where were they getting care at that time? Was that at their doctor back home in St. Paul, or was it here at Health Services? Does that make sense what I'm saying?
To directly know what to change here.
Directly know, right, so I can make changes here. Because certainly I want to make sure we're doing all we can do. I think, like I said, I think we're all learning.
Okay. Yeah, well, we are still doing interviews one-on-one with, like, international and cultural students. So we'll try to specify that to try to get some results back to you.
Because I mean, specifically, I know there's a few comments from some students that identify as being from the Hmong culture. And I was just curious if some of those were from here, like comments related to interactions that happened at the health center or back at their home physician. So
cool. Yeah, we can try to get that for you then. Great. Well, thank you for answering all our questions.